Morning everyone, or actually afternoon. It is Making It on Mondays with me, Louise Jeffrey, and I am just going to check my setup and see that we are okay. It looks like I'm live. Right, I hope that you guys can see me. Hold on a sec, it's telling me to close some unused applications, which I'm just going to do. Give me one sec so that the live stream can be really good. All right, beautiful. Here we are. So today we are talking about diet and fertility, and we're going to talk about the top 5 things that you need to know to optimize your fertility with food and with diet. So for those of you that don't know, my name is Louise Jeffrey. I'm an acupuncturist. I'm a practitioner of Chinese medicine. I'm a hypnotherapist, and I'm also an eating psychology coach. And we're going to be on together today for around 20 or maybe 30 minutes, just depending. Sometimes I can chat a bit longer than normal, but I'll try and keep it to time today. So please feel free to ask questions or make comments. And I'd love to hear that you're on with me today. If you are, whether you're on live or whether you're on replay, please let me know, because it can feel a little bit lonely out here by myself. And I'll just keep checking the comments to see who is on with us. Alrighty, so let's get started. So before we start, I wanted to ask you guys this. When you first started trying to conceive, I wonder if you found it easy or confusing when it came to food and what you should and shouldn't eat to help optimize your fertility. Now, many of our patients come into the clinic and they're really, really keen to know, what else can I do to help my chances of conceiving? And diet is one of those things where we can really make a big impact. And so that's what I'm going to talk about today. So there's a lot of information out there. There's a lot of information. There's also some misinformation as well, but there's a lot of information out there about what constitutes a really good preconception diet. And hi Liz, it can be really quite confusing at times. But what I'm going to take today is I'm just going to talk to you about 5 key things that you can do that will really make a difference in terms of optimizing your fertility. And I'm also just going to talk to you a little bit from a Chinese medicine point of view, and I'm going to talk to you a little bit from an eating psychology point of view. So we're going to talk about why how you eat is just as important as what you eat. And that's going to be the last point I'm going to share with you today, and it's really going to be quite important, so I hope you can stay on for that. All right, so from a Chinese medicine point of view, when it comes to diet and it comes to food, what we are always recommending is that the middle road is usually the healthiest, right? And what we mean by that is that we mean that a diet that's moderate, right, or that excludes some foods but not all of them, is really, really helpful in creating a kind of balanced diet. And what I mean by that is that we have fresh fruit and vegetables in our diet, and we have adequate protein. And when we kind of come to a diet of moderation, right, and a diet of variety, it really helps us to optimize our fertility. So having said that, and that sounds a little bit broad, right, traditional Chinese medicine always takes into account that each of us has a different constitution, right? And so when we're talking about diet, we're talking about moderation, and we're talking about, hi Vanessa, we're talking about moderation, we're talking about, about variety, we're talking about a well-balanced diet, but we're also talking about the fact that everybody has a different constitution. And so in clinic, we consider each individual before we offer final dietary advice, right? And I'll give you an example. So for example, someone who presents with a lot of heat in their body, right? So somebody who's got a red tongue, somebody who has a faster pulse, who might get thirsty a lot, who feels the heat, who feels hot more often than cold. Someone who presents with a lot of heat in their body will generally want to avoid foods and drinks that create more heat in the body, all right? And this is because that further dries the bodily fluids, which is something we don't want when we're trying to conceive, right? And if we're creating more heat, we can also cause insomnia, for example. So what I'm trying to say here is that when you come into the clinic and we consider your constitutional type, we will also be sharing with you different things that will be helpful or unhelpful for your diet, right? Another example is someone who has a weak digestive system, right? And there's actually quite a lot of us out there. Someone who has a weak digestive system might be prone to excessive damp in the body, right? And damp is just where the body's not metabolizing the fluids adequately, right? And so we suggest with someone who's prone to excessive damp that a person like this actually will avoid foods that cause damp in the body. Like, for example, dairy causes damp, or excess dairy causes damp, or oily foods, too many oily or greasy foods can cause damp in the body, right? Now, because a properly functioning digestive system is really an important focus of our treatment, all right, we need a properly functioning digestive system because we want our nutrients to be absorbed and utilized well, right? It's really important for us to make sure that your digestive system is functioning properly. And also because given the proximity of the digestive system to the uterus, if the digestive system is warm and the blood flow in the clinic, we actually ask you whether you have any digestive issues such as bloating or constipation or reflux or cravings or even low appetite, right? So having said this, that everyone has a constitutional type and that certain foods are less helpful for some types than they are for others, there are also some bits of advice that we can share with you from a Chinese medicine point of view that'll cover everyone and that'll be helpful for everyone, right? So you can take away these bits of advice and you can start implementing them in your daily life if you haven't done so already, and they'll be really helpful for your fertility. So I hope that this makes sense. And if it does, let me know. Let me know in the comments, if I'm making sense. So what do we know about diet and fertility? Okay, well, we know from research and from clinical studies that optimal nutrition, in other words, eating well, and we'll talk about what eating well is in a moment. Optimal nutrition helps to provide an ideal ovarian environment, right? So an ideal environment for the eggs and also an ideal environment for the sperm during what we call the critical maturation process. So that's when, right, the sperm or the eggs are maturing over a number of months. And what we also know is that an optimal diet contributes to the optimal environment in the uterus, right, for implantation of the embryo and, of course, development of a healthy baby. So when we're eating well, we know from research and clinical studies that it improves our fertility. All right, so let's get on to the interesting part of today's discussion. We are going to talk about our top 5 tips that you need to know about diet and about fertility, which will help to optimize your chances of conception. So tip number 1, sorry, I've got a bit of a catch in my throat today for some reason. Tip number 1 in diet and fertility is variety. Now, most of us think, well, I eat a fairly good variety of foods, right? I eat a wide variety of foods. But the reality is, when a lot of us actually look at our diets, a lot of us really don't eat a huge variety of foods. And why is this? Because firstly, we're often eating on the run, right? And we don't take the time to prioritize food, right? And B, because in the modern world, we're actually quite spoiled for choice. And what happens is that we have our favorites and we tend to stick to those, right? We don't give food too much thought. We almost deprioritize food. And so we often end up limiting ourselves in terms of what we actually eat. If we were more relaxed and we really prioritized food, we would consider much more than we generally do in most of our diets, right? So what do we mean by variety? Well, the best way that I like to think of it is, are we including all the colors of the rainbow in our diet, right? Why do we want to include all the colors of the rainbow? Mainly because when we eat a variety of healthy foods, we actually offer the body the best possible chance of extracting all the nutrients it needs to conceive and to have a healthy pregnancy and baby, right? Our bodies are designed to extract and assimilate nutrients from a wide variety of foods. The body likes variety. So in Chinese medicine, we always recommend having a wide variety of tasty and fresh foods in season. And it may feel a bit to you like I'm speaking something that's kind of obvious, but if you look at your diet, you'll probably find that you don't have as much variety as you actually think you do. So we need to make sure we're getting plenty of healthy protein, especially vegetable protein, and getting lots of fresh fruit and vegetables, and eating them organic where possible. All right, so that is variety. Tip number 2 that you need to know about diet and fertility is to eat clean and to eat whole. Now, remember I said that we know from research that optimal nutrition provides this optimal ovarian environment for the eggs, and it provides an optimal environment for the sperm during the critical maturation process. Now, when we're looking for optimal nutrition, we really need to be eating clean and eating whole and eating organic. Okay, so not just a wide variety, right? But when we're looking at optimal nutrition, we need to be eating clean, whole, and organic. And here are some tips to help you with this. The first one is to pick whole fiber-rich foods. Our diets in the Western world have actually become far less rich and abundant in fiber than they used to be because they're far more processed foods in our diets, right? So we want to pick whole fiber-rich foods. And what that does is it actually hydrates our bodies. We won't have to drink as much water if we're having fiber-rich foods because there's a lot of water in the foods, the fruit and vegetables that are rich in fiber, right? So we want to be eating whole fiber-rich foods. We also want to be eating organic where we can. So we want to be eating foods that are unprocessed and free from pesticides, from hormones, from preservatives, and from additives, right? And why is this necessary? Well, it's necessary because we know that pesticides can affect the delicate balance of our reproductive hormones, and they can also affect male sperm production. Now, I know that it's not always possible for everybody to eat organic. Maybe that you don't have all organic food available, or you can't afford to always eat organic, right? But if you can't, then the best thing to do is to make sure that you soak your non-peeled fruit and vegetables in warm water with a tablespoon of bicarb for around 10 to 20 minutes before you eat or before you cook. And what this does is it just makes sure that the pesticides are removed. And then make sure that you rinse them after you finish soaking them, right? And then we also recommend that we stay away from meat and from poultry and from fish that's been farmed with the use of growth promoters or hormones or antibiotics, because all these interfere with reproduction. Yeah? Okay. So what types of foods am I talking about when I'm saying to you that, we need to eat whole? Well, the obvious ones are really lots of fiber-rich veggies, fresh fruit, whole grains. Like I said to you guys, the more colorful the plate, the greater the range of vitamins and of minerals that you'll be getting. So think of things like, red capsicum, orange carrots, green spinach, yeah? And think of all the colors of the rainbow. And then sometimes people ask me, how much protein should I be eating versus carbs? What's the ratio, everything? And all I ever say to anyone in terms of ratio is that start with 80% of your diet as clean fruit and vegetables with some healthy protein, and then listen to your body about the rest, right? And your body will guide you towards what it needs. Now, I'm a really big believer in body wisdom and in body-led eating, right? And I think that in the modern world, we've actually moved away from the body guiding us towards what we need. And we've become far more accustomed to using science and using our rational minds, right, to pick and choose what it is that we need to eat. And what happens is that this often leads to nutritional inadequacies, right? Because the body has an innate wisdom about what it needs, and it will create cravings for things that we really do need, all right? So that's a whole nother topic that we could spend a lot of time, talking about. We could spend a whole session just on that, but on body wisdom and on body-led eating. And if we want to, we can go in and talk about that. But for now, just to say, listen to your body, try and give your body the time and the space to really tell you what it is that it needs. All right. Tip number 3 for diet and fertility. Reduce the amount of sugar and processed foods in your diet. Now, again, this might seem a little obvious to you, but I'm just going to talk to you now about why it's important. But before we talk about sugar and processed foods, I actually just want to mention dairy quickly. Now, if you have no problem digesting dairy, then you're good to have it, right, in small amounts. But with dairy, what we suggest is that full fat is much better than low fat or fat free. And that's mainly because the low fat and the fat free are really highly processed, right? So in Chinese medicine, we believe that too much dairy and too much sugar cause damp in the body. Remember earlier I was talking about how the body struggles to metabolize the fluids, right? And we get excess damp in the body. So too much dairy and too much sugar cause damp in the body, and they weaken the digestive system. So what we always suggest is that we reduce the intake of both dairy and sugar, right? And this is even more important if you have a weak stomach and spleen, all right? And for someone with a weak digestive system, we always suggest reducing the intake of both of these. All right, beautiful. So if you want to know whether you have got a weak stomach and spleen, or if you're a hot or a cold person, your acupuncturist can really let you know when she sees you. All right, and if you're partial to dairy and you really like it, or you've got a sweet tooth, try choosing healthier, non-dairy, natural sugar options where possible. So things like vegan chocolate or dates, for example. Those are two of my favorites. There's always other healthier options if you have a sweet tooth and you really want, you want to eat something that is that tastes like dairy. Vegan chocolate is great, or something sweet. Yes, Vanessa, you're right. More fiber means less water to drink. Absolutely. Yes, and rainbow meals also make me smile. I love this whole concept of actually looking at the plate and seeing all the different colors and going like, wow, that's how we're meant to eat, right? For the whole of evolution, we've eaten what we kind of grew, except obviously in periods of famine. So in periods of abundance, we would be able to choose all these different colors of the rainbow of the things that we grew. All right, so I'm just going to talk a little bit more about refined sugar and processed foods and why it's important and why we suggest that you reduce or you even cut these out when you're trying to conceive. The simple reason that we really want you to reduce the refined sugar and processed foods is because they create inflammation in the body, right? Now, the body doesn't like inflammation. Our bodies are actually always trying to reduce our levels of inflammation, constantly, trying to make sure that our inflammation is low, because inflammation interrupts our body's natural functioning, right? And it eventually leads to disease if it's left unchecked. So our bodies are always trying to bring itself back to homeostasis or to balance. And when the body is constantly having to try really hard, it's constantly having to battle to reduce inflammation, it doesn't have the extra energy that it needs to put into the other bodily functions like digestion or reproduction, right? And it's a constant battle for the body to constantly be reducing inflammation all the time, right? And if we continue to put excess amounts of processed foods into our bodies, right, we're going to end up with chronic inflammation. And chronic inflammation in the body eventually leads to autoimmune diseases, like endometriosis, for example. Yeah. And the way I like to think of it is eating processed foods is hindering the body, whilst when you eat whole, clean foods, it's really supporting the body, right? Now, does this mean that you can never eat another piece of processed food again? Definitely not, right? I always work on the 80-20 rule, right? Which is what I said earlier. If you eat right 80% of the time, if you eat 80% of fruit, vegetables, and healthy proteins, then the body is going to metabolize the other 20%. Now, you'll see that I haven't mentioned carbs. Carbs fall into that fruit and vegetables and whole grains, right? That 80%. So as long as we're, don't worry so much about the macros, about the proteins, carbs, and sugars. Focus more on eating 80% fruit and veg and healthy proteins and whole grains. And then you've got another 20% to play with, right? Where you want to be having some vegan chocolate or some, something that's a healthy sweet or a healthy treat or whatever it is for you. All right, does that make sense? Or a beautiful glass of wine if you want it every now and again. So, in my mind, and this is what we learned in eating psychology training, is that this sort of balanced and moderate mindset is really the way to go. Because if we go too hard on the restriction side of things, if we restrict too much and we diet too often, unfortunately for every single diet, there's an equal and opposite bench. The elastic that we pull back into restriction always bounces back again to excessive eating. And those of you who struggle with overeating and who have been dieters for the longest time will know what I'm talking about, right? I was a binge eater for many, many years before I studied eating psychology, and I know all about what it's like to be flip-flopping between, dieting and overeating, right? So if we pull the elastic too far back and we don't have that moderation, and we don't sort of sit in the middle quadrant, we're going to end up constantly going backwards and forwards. Okay, hope that makes sense. And if this resonates with you, or if you struggle with your eating, let me know in the comments, and I'd love to know if you've got any questions around that. Okay, so tip number 4 of our 5 top tips on diet and fertility is to reduce alcohol and caffeine. Now, this is a really hot topic because for many of us, especially if you live in Sydney and Melbourne, right, coffee is like part of our culture, right? And alcohol is in a lot of ways too. And in some ways, they're the two really pleasurable things that we have in our lives. But the problem here is that high caffeine intake is actually associated with infertility and increased miscarriage rates. So even moderate coffee drinking, in other words, like 1 to 3 cups a day, can actually reduce our fertility. So if you're a coffee lover, and if you are, let me know in the comments box below, I would love to hear from you. Now, I'm a coffee lover, right? I love the smell of coffee, but unfortunately, coffee doesn't love me, so I don't drink coffee anymore. But there are a few studies that have highlighted this, and I'm not going to go into them now. But what we know is that, when we, even drinking, 1 to 2 cups of coffee a day can actually reduce your your probability of conceiving, right? Obviously those who are in the high risk category of drinking sort of 3 to 4 or 4 to 5 cups of coffee a day, that can absolutely impact our fertility and reduce our chances of conceiving. In fact, there was a study from the University of California that found that for women undergoing IVF, that alcohol consumption of 1 glass per day in the month before their treatment reduced their success by nearly 3 times, right? And for men, alcohol consumption in the month before IVF reduced their chances of success by up to 8 times. So if you're undergoing IVF, we recommend that both men and women abstain from alcohol consumption at least 1 month before the egg collection. And that's really to maximize the effectiveness and the success of the IVF procedure. So I know that all these stats and these numbers may sound a bit gloomy, but they don't have to be, right? What we're suggesting is that you reduce your caffeine intake to 1 to 2 coffees per week and maybe 1 tea per day, right? So this can really make a big difference to your chances of success. Now, if you've got a hot constitution, so for example, if you tend to run more hot than cold, like I said earlier, or you feel thirsty a lot and you feel heat or you get sweaty at night, then avoiding coffee altogether whilst you're trying to conceive is preferable. And this is really because caffeine is a stimulant, right? It creates heat in the body and it dries the bodily fluids. And this is really not helpful for fertility. Coffee is actually also a diuretic, which means that we're often left feeling even more dehydrated. We have this kind of rule of thumb that goes, for every cup of coffee that you drink, you need to drink 2 more cups of water than you would normally drink. And for every cup of tea, it's 1 more, right? So have this rule of thumb. If you have a cup of coffee, you need to be drinking 2 more in between. All right. I know for some people, it's not just as simple as giving them up, because there's some really positive associations with both alcohol and coffee. It's a really huge part of our culture. And I can relate to both of these. In our culture, we relate coffee and alcohol to connection and to pleasure. And so giving them up can really leave us feeling deprived and disconnected, right? So, if it really resonates with you and you really feel like you're going to be missing your coffee or missing your tea or missing your alcohol, then just keep looking for a healthier option, like a chai tea or a herbal tea or an alcohol-free version of, what you're looking for. Maybe it's an alcohol-free margarita, because you normally drink margaritas, or an alcohol-free wine. There are lots of them, available and around at the moment. Vanessa asked, what's a diuretic? So Vanessa, diuretic is something that makes you go to the bathroom more often. So it's something that makes you urinate more frequently. And what it does is it then pushes the water that you have in your cells out of your body and makes you even more dehydrated. So that's what caffeine does, right? It causes the body to urinate more and to let go. So that's what a diuretic is. The other suggestion that we have around coffee is to dilute your coffee by half. So what you could be doing is, if you've dropped down to like 1 coffee per day and you'd normally have a double shot, have a single shot. Or if you normally have a single shot, have a half strength, right? That can go a long way to reducing the heat that you end up having in your body. All right, let's get on to the last, because I know that we're already 25 minutes in and I've only got 5 minutes left. So the last, or the 5th tip, for diet and fertility is to eat mindfully. Now, this is very much more around how you eat rather than what you eat. And you may have heard or read or even practiced mindful eating, but I'm going to share with you why how we eat is just as important as what we eat, right? And so I want to just take a moment before we get into this conversation and talk about our relationship with food. And I'd like to ask you just to reflect, and maybe you can write it in the comments box for me. How do you eat? Do you sit down and take time to really savor and enjoy your food? Or do you treat eating just as another part of your everyday routine, and do you like squeeze it in wherever you can find time, right? So let me know in the comments box, are you a fast, are you a medium, or are you a slow eater? I'd love to know. And I'd love to know because I'm going to talk to you in a moment about why that's important. So Vanessa says, so it heats us up and dries us and also makes us urinate more, leaving us double dry. Yes, exactly. Spot on, Vanessa. That's exactly right. That's 100% right. So it really has, it double dries us up, exactly as you say, right? It creates more heat and dries us even further. All right. So are you a fast, medium, or slow eater? Let me know. Now, when it comes to eating, what's interesting is the way that we eat has a direct effect on our digestive system and the way we metabolize food. All right. So when we eat fast, or when we eat distracted, or when we're stressed out, we lose 60 to 70% of our digestive and metabolic capacity. I'm going to say that again. When we eat fast, when we eat distracted, or when we're stressed out, we lose 60 to 70% of our digestive and metabolic capacity. Now that's a lot, right? And this is what clinical research has actually shown us. There's a trial which I won't share with you now, which is called the dichotomous eating trial, which was absolutely amazing, but it basically relaxed manner, we lose 60 to 70% of our digestive and metabolic capacity. So just as wood in a fire needs oxygen to burn, your stomach needs oxygen to burn food. So if the digestive fire burns dimly, food is stored as fat. Yeah. So when we're in the stress mode, we instinctively breathe faster, right? I don't know if you've ever noticed when you're in stress, you notice that you breathe fast. And what happens is when we breathe faster, this leads to a sluggish metabolism, right? And then we have extended periods of shallow breathing, right? Which then results in low oxygen intake, poor digestion, body stress, and then ultimately weight gain, right? Can you see how that actually works its way around, right? And of course, from a fertility perspective, if we aren't digesting our food properly, the body won't be able to extract the nutrients that it needs for conception. And when we eat fast, our digestive system is really slow and it's sluggish. And so this impacts the blood flow to our uterus, which is really close by. Does that make sense? I hope so. All right. So Vanessa says she's a medium eater. Okay, fab. And Liz says medium eater, but I'm really slow with a cup of tea. It can take an hour. Okay, good. Beautiful. Drinking a cup of tea or something warm with your food is actually really, really good. Sipping it, because it helps to soften the food. In Chinese medicine, we always want the food to be soft, right? We love to have foods that are very gently cooked and warm and softer foods because they're really good for the digestive system. I know, Liz, isn't it amazing that metabolic capacity can be so influenced by stress, right? Yeah, I mean, it's most of us, even if we don't feel like we're stressed, we're living such a fast-paced life that our bodies are in the stress response, and we have really, really sluggish metabolisms and digestive systems. And that's why weak digestive systems are really endemic in our society today. All right, so I'm going to teach you guys a really simple technique, and it's essentially mindful eating, but I'm going to talk to you about why it's important as we go through the steps. And what it will do is it will maximize your metabolism, and it'll get your body burning fat more naturally, right? And what it will ensure is that your body is metabolizing and absorbing the nutrients that it needs from the food, which will positively impact your fertility. Okay, so here are the steps to mindful eating, and I like to break it down into 3 steps so you can get clear on what's required. Step number 1, the first thing that you need to do is before you even start eating your meal is to stop and breathe. Okay, So without even picking up your fork or spoon, take a few long, deep breaths in. You can breathe in through the nose. You can do pranayama breathing, or you can just breathe in for 4, hold for 4, out for 4, hold for 4. And do that quite a few times, maybe 10 times. And we breathe deeply for as long as it takes to reach a slow, deep breathing rhythm. Now, if you're already partly relaxed, it's only going to take around 3 breaths. But if you're stressed, it'll probably take about 10 breaths, right? But as you breathe, I want you to start to smell the food, right? I want you to start smelling the food and thinking about it. And what this does is it really starts the digestive process, because it gives your digestive juices a chance to prepare for what you're about to digest. Okay, and then as you begin to eat, you need to continue to breathe mindfully through your nose. And what this does is it mixes your food with high doses of oxygen. And what it does is it creates optimal conditions for boosting your metabolism, and along with it, you raise your fat burning capability, right? And you're getting your digestive system working much more efficiently so that you can absorb the nutrients better. Does that make sense? All right, so the first thing to do is to make sure that you breathe before you even start eating. Then step number 2 is to eat slowly. Because when we eat too fast, whether it's because we're stressed or because it's become a habit, we don't give our stomach enough time to tell the brain that it's had enough. And so we just continue to keep on eating, right? But the truth is, it takes 20 minutes for brain signaling hormones to signal the brain that it no longer needs food, right? So as a guide, you should really only eat a full meal when you've had 20 minutes or so to do so. Now, I know that's not always possible in our busy lives, right? But what we do is we try our best to extend our eating time if we can. Now, you may or may not know this, but the way that the body regulates our appetite is via a protein called leptin. Now, what happens is that leptin tells the brain to inhibit our appetite when our digestive system signals that we're full, right? But if we eat too fast, we don't give the brain enough time to tell the body we're full, right? And if you're struggling to lose weight and you overeat or you eat too fast and you've done so for a period of time, chances are you may not have enough circulating leptin, right, in your body. And a shortage of leptin in the long term not only leads to reduced appetite control, but it also leads to increased cravings, right? Meaning it's harder for us to know when we're full. But the good news is that you can naturally increase your leptin production by slowing down your eating, okay? So as I said, the guideline is eventually work your way up to taking 20 minutes to finish each meal, because this is really the optimal time for digestion to occur and for the brain to let us know when we're full. Okay, does that make sense? All right, then step number 3. So the first, step 1 is to breathe before you eat. Step 2 is to eat slowly. Step 3, eat with all of your senses and take deep pleasure in your food. Now, whether we like it or not, we are designed as human beings to gain pleasure from eating. All of our bodies, all right, have what we call a pleasure quotient. And we need this pleasure quotient to be filled. And if we allow the body to receive pleasure from food, the body won't need to overeat because it's filled that pleasure quotient. Does that make sense? All right. So here's how to eat mindfully. Sit down, make sure you're away from the work desk, you're away from the television, you're away from the phone. Switch it all off and focus on your food, right? And give thanks for the nutrition it offers your body. All right, relax and breathe, long, even breaths, like I said before. And then chew slowly, right? Savor every mouthful. What we want for you to do is to experience the maximum pleasure possible from the food by eating using all of your senses, right? So bring your sense of taste, of texture, of sight, and of smell, not just what we think of taste and we're off for the fairies thinking about everything else, right? Focus on the food, focus on the senses. And when you find that that meal has satisfied your desire, then put down your knife and fork and stop eating, right? And by relaxing into the experience, we actually stay aware and we can sense the exact quantity that was just right for our body, right? Does that make sense? And so no matter what you're eating, no guilt, right? Guilt is a stressor to the body and it raises our stress hormone levels, right? Signaling the body to store fat and it slows down and makes our metabolism sluggish. So if you want to have that piece of chocolate cake and you're going to do so anyway, do it with love, right? And fully experience how pleasurable it is to indulge in that food, right? And when you eat in this way, you'll find that your digestion will improve, your metabolism will improve, your fat burning will improve, right? And what happens is that weight loss and then good health and optimum nutrition, right? And then fertility naturally follow. All right, does that make sense? I hope so, and I hope that was really insightful for you. So that brings us to the end of our 5 tips for today, and I'm just going to recap really, really quickly. Tip number 1 is to eat a variety of foods, right? Think all the colors of the rainbow. Tip number 2 is to eat clean and eat whole. Tip number 3 is to reduce sugar and processed foods. Tip 4 is to reduce coffee and alcohol, right? Or cut it out altogether if it's possible for you. Tip number 5 is to eat slowly and to eat mindfully. Now, there are lots of resources online. If you want to know more about mindful eating, go and have a look. It's something that took me a while to master, but it was literally life-changing. It's really, really beautiful. So I hope that this has been helpful for you. I know I've gone about 5 minutes over time, so I apologize. Whether you're on live or whether you're on the recording, please feel free to ask questions or to make comments. We'd love to hear your questions. We'll be in the group in the next couple of days answering them. And Amy will be on Make It on Mondays. She'll be live next week. And I'll be on the following. And I hope you guys have a beautiful, beautiful week. Bye, Liz. Bye, Vanessa. Bye, guys. I'll see you all soon. Bye for now.